Hi, I'm Kenny Anderson, Director of Multicultural Affairs for the City of Huntsville, and welcome to Impact. Each week we have the opportunity to share exciting things that are happening right here in this community, and today will be no different. Each year we have the opportunity to talk about a very important and dynamic community health fair that takes place on the campus of Oakwood University. And here today to talk with me about it, as he has been in years past, is the Underwriting Director for WJOU Praise 90.1 FM, which is the primary sponsor of this event, along with some other folks that you'll hear about, Mr. Ron Gilbert. Welcome back to the program, Ron.
Kenny, it's a pleasure. Thank you for having us back.
Well, it's always this time of year, and it's always pretty exciting, not just planning this process, but also executing the process. This is your fifth year, which means that you have a little bit of a track record now, and you have some lessons learned, of course, and some opportunities going forward. It's got to be exciting to have this thing coming up for the fifth year. What have you learned thus far in the process?
Kenny, what we've learned thus far, and again, we want to thank you for inviting us, is that the university, its reach is health and wellness, okay? And this is something that we intertwine with what's going on at Oakwood as far as our health fair is concerned. I remember when we first thought of this 5 years ago, we said, what can we do in relation to the community to share with them not only opportunities, but to inform them and to let them be a part of health and wellness in the area of testing, in the area of information, in the area of seminars, and this is what we've been doing. So every year it's been making this better, making this more advantageous to the community. And this is what we're doing every year. It's a challenge.
Well, it's always a challenge, I'm sure, because you're trying to put together so many different moving parts, but all for the good of the community. And, you know, Oakwood, of course, being an institution, has been around since 1896, a fixture in this community in so many ways.
Very true.
Has evolved over the many years, but has always had a strong emphasis on health and health education. Being able to provide people with the best information that they can get about how to keep their bodies healthy for as long as possible. And of course, this health fair, this community health fair, ties into and supports the mission of the institution.
It does, Kenny. In fact, going over the past few years, the escalation of vendors, the escalation of people that come to the campus, it's been tremendous. We've been well received in the community. And we keep on point with the fact that this is a community undertaking that we're doing. It's not only for the university and its occupants. Of course, they're welcome. But we want to spread the word in the community as far as the information that's available, the medical information that's also important, health today, you know, I'll be emphasizing that as you will. It's just so premiered today. And we've been able to do that the past 5 years, the past 4 years, this being our fifth year. So again, this is our fifth annual. We feel as though we've been doing something right, Kenny, but every year, as you alluded to, we try to make it a little better. We want to have that vendor who's going to be there, who's going to really have that information that we may have left off in past years, okay? We have repetitive vendors that come back to us. Huntsville Hospital Mobile Unit, these folk come to us now. The blood bank, you know, when the blood bank they're also a participant, they informed us that they were able to get more contributors than any other health fair. And this is health fair season in Huntsville.
Sure.
So we take that very seriously. And it's something that, again, this will be our fifth annual. You know, I'm glad to say annual. Once you get past the first one, then you can say annual, you know. So we're very pleased. We've got a lot that's going to be involved in that. One of the things that we do is that we will, well, let me say this. The emphasis of the health fair is to provide scholarships for our students. That's so key to us. In the past 4 years, we've given over $10,000 in scholarships. This year, we will do the same. Our objective is to give away $5,000 scholarships. And trust me, the students really appreciate this. This is a big help to them.
Well, it is. And just to further clarify that, part of the underpinning is the opportunity to raise funds, to provide scholarships. First and foremost, we want people to be healthy enough to sustain their lives. Our young people are coming to school. They're, you know, taking lots of classes. They have hectic schedules. They always don't have the best nutritional access sometimes. They don't always make the best nutritional choices. And so we want them to be healthy through their college journey, and then we want them to be able to pay for their tuition.
Yes, we do.
And so the two working together provides a tandem that certainly works for the institution as well as the students and those that come to learn about health. It sounds like a great combination.
It's a beautiful combination. Aside from that, last year we had close to 500 people that came through to see and to observe and to take part in the information that was there. We're anticipating that same thing this year, okay? Some of the things that they're going to be getting when they come, of course, we've got health screening, we've got cholesterol checking, we've got blood pressure, heart rate. We're going to have seminars on different health entities that really help people focus on what that particular information they need in regard to their illness. And here's the thing too, people can learn from what we do, what we're presenting from the vendors, to share with their families, to share with the community. So it's that type of information that we want to get out, and it's that type of information that we want to share. Another component is the fact that we will have, we'll present community, we're going to be working in the community, we're presenting community awards, forgive me. We do an internal award and we do an external award.
What does that mean?
Okay, we're looking for someone who's been a part of the community from a health conscious way, okay? Definitely helping the community, being on point with them. Case in point, last year, Kathy Miller was our recipient for Off Campus, okay?
And Kathy is, for those that don't know, she's Community Impact Director for United Way Madison
yes,
County.
Yes, she is. Yes,
and
she is.
Part of their 3 emphases include the issue of health.
Exactly. Artist in Sydney from the old Garden Cove, as many people may know.
Artist in Edna Sydney.
Edna Sydney. They were the recipients last year.
And of course, artists now in Edna are running the Oakwood Farms.
Oakwood Farms. And
which is a new initiative.
It is, and putting a plug in for them, it's doing very well. And please come on campus and get your fresh fruits and vegetables.
Yeah, great initiative that was just launched last year. It seems to be really
Exactly.
taking off and actually making an impact on the community.
Exactly. So this is what we're doing. Again, this is our 5th annual. We're looking for vendors. This is an opportunity for vendors to come aboard. We're set up online so that you can fill out the application for vendorship, okay? We're also looking for still tier sponsors. You know, we have a deadline date, and we're still looking for tier sponsors to really be up there with us, okay? Last year, well, let me put it this way. Our co-sponsors last year were Breath of Life, Oakwood University, Siraj Service Groups Incorporated. All of these people are back with us this year. So it tells us that we're doing something right, okay? Because when people come to you and when people say, yes, I want to be aboard again, that's a very positive information that the community has received, and we want to continue that.
So a typical vendor would be who? Are you looking at not just physical health vendors? Are you looking at emotional health vendors? Are you looking at spiritual health vendors? It just seems like health is a very broad subject, and a lot of times I think people focus on the blood pressure and the blood sugar and the obvious things of health. But listen, if your mind isn't functioning right, you're not going to be too healthy. And I know enough people that have migraines and ulcers and other kinds of conditions that are actually driven by the psychological side. Of course, that's my mental health background. I know that to be true, but that seems like that can be a very important emphasis too. Are you looking for the whole spectrum of people, for those that are listening now and may want to get involved?
Yes, we're looking for that whole spectrum that you've included. And this is necessary because, as you said, it's more about being tested. It's more about determining what your glucose level is. We want to get into information that's going to help families internally, okay? The areas that you've mentioned, you know, hypertension, suicide, depression, massage therapists. We're doing the whole gamut as far as health is concerned. And we want people to really feel free to come on campus. We have a very open door policy as far as that's concerned. You know, so feel free to come on campus as we talk today because we have a very friendly campus. And one of the things that we pride is letting the community know who we are and what we do.
Well, health is a whole body experience. You know, if you are feeling well, but you don't think well, it's going to make you sick. If you're not thinking well, it's probably going to affect you physically. And then all these other challenges that can occur can certainly weigh on a person as well. So that whole person approach seems like the absolute direction to be headed in. It sounds like the direction you all are going in.
Yes, it is.
So people, of course, as you said, may want to consider to be a vendor. I believe there's a nominal fee for that. People can call and find out about that.
Exactly.
I think that people that want to provide support for the event can also call you and find out about that as well. But these opportunities do exist still for people to come on board and provide that kind of support, right?
Yes, they do. And as I said, if you go on our website, WJOU.org, you're able to sign up as a vendor. You're able to pay online as a vendor. For more information, of course, 726-7420 and 726-7418. Those are numbers that you can call to get internal information from our station itself. And we've got someone that's waiting to answer you, trust me. And this is going to be a very good event again. You know, I say that every year. Every year we want to make it even better. Every year we're inviting more people to come as far as the community is concerned, vendors. You know, again, last year we had probably over 60 vendors. We had to turn vendors away. So again, I go back to the fact that we're doing something right because we're getting an interest from every facet as far as the health realm is concerned.
Yeah. So one of the questions that I have is, how do you know that this health fair is successful when you're doing your assessment process? I know you've got a committee. I'm actually part of that committee working with that process.
Thank you for being there.
Absolutely. I mean, this is a no-brainer for me in so many different ways.
Mm-hmm.
But there's another major health fair that I work with also throughout the year. And just a short story from that and why we know that that health fair is successful. There was one year when a man came by and got his blood pressure checked.
Mm-hmm.
Well, his blood pressure was so high that he was instructed to immediately go to the emergency room. And when he immediately went to the emergency room, he found out that he could very well have had a stroke as a consequence of that or some other medical issue. And this was somebody who just chose that morning to go by the health fair, get something checked out, and it turned out that it may have even saved this person's life. So when I ask the question, how do you know that this is successful? It's those kind of stories that I think about. The opportunity presented for people to learn about where they are as far as their health is concerned. Even people who have minimal access to health care or challenges that they face to health care can get access through this community health fair.
Yes, they can. I think what you're saying is right on point. Many times people come and they find out what's going on with themselves. Many people are reluctant because of they're thinking they have to pay, the uninsured. So this is an opportunity for people to really get a full spectrum of health testing, have someone to talk with them no matter what the condition might be, and hopefully we can talk to them. And the key thing is this: if we can't help, we've got people there who can tell them where they can get help from.
Yeah, and that's the main thing.
It really is.
So where can people get more information? Once again, we've given them a website, we've given them a phone number. Let's go over that one more time, and then let's tell them where the event will take place as we close out.
Okay, here's what we can do. You can call 726-7420, 726-7418. Those are incoming numbers to the station. You can also call Good Samaritan Hospice, okay? And I want to say, too, that Good Samaritan is our partner in this. They've been our partner from the beginning. We've appreciated what they've done, and we want them to continue, and they do want to continue as far as being supportive. A couple of important people over there who work real hard with us. Jim Pride. Jim was here with us last year. Jim is the marketing director. Of course, Janet Melton, the owner. The whole group over there is very, very responsible for helping us in what we do to make this happen.
All right, so tell us where it is, when it is.
It's going to be on the campus of Oakwood University, October 26th from 11 to 3. October 26th from 11 to 3 on the campus of Oakwood University, and it's going to be held at the Millet Activity Center. Again, coming into the gate, you will be informed where to go. As a station, we're putting out information to our vendors, directions. We want to make sure that there's no mishap in coming aboard and coming on campus to get the necessary medical attention and the information that's needed.
All right, big community health fair coming up. Don't want to miss it. October 26th. Ron Gilbert, Underwriting Director for WJOU, Praise 90.1 FM. Thank you for being here with us today.
Kenny, it's been a pleasure, and thank you for being a part of and inviting us here again.
All right, we want to thank you for being a part of our conversation. We hope that you put that information down, that you can go to WJOU.org, find out more information about how you can be involved in this process, or call 256-726-7418. I think that's the number, or a number. If not, they'll direct you to the right place, and we'll make sure that you find out where you need to go as far as this process is concerned. And another point, folks, is that this is the kind of thing that we like to talk about because it really places the responsibility for your care right in your lap. You can do this for yourself, you can do this for a family member, a loved one, a friend, but everything that you do as it relates to your health maintenance is important, and that's why we share it here. Now, you can see a video of the show that you just watched at our Facebook page, which is Impact with Kenny Anderson, and you can also see some behind-the-scenes shots of what happens once the camera stops rolling. For Impact, I'm Kenny Anderson. Hope you have a great day.